We know that retention is such a huge topic, especially as it relates to staffing challenges and staffing shortages. From your perspective, what strategies have you implemented to address those challenges and promote retention?
So we've done quite a few things. We had 3 staffing summits where we brought a whole group of people together and we talked about what are our safe scheduling guidelines, what is our weekend commitment, who's getting pulled from the unit first if someone has to, float out, what's the hierarchy of cancellations if, somebody wants to volunteer if you're overstaffed or something that hasn't happened in a long time. Just looking at those pieces and making sure that we're fair and equitable across the system. We looked at we had a vacancy rate, and when we had a sign-on bonus, and the sign-on bonus was kind of out there for everybody. But when we looked at the data really closely, we realized there was 2 pockets of vacancy on 2 units. So we had to be specific about where are we going to place our energy to make sure that those units are getting first dibs and getting looked at, and that we're, making sure that the staff there have enough people to work with every day. There's a lot of other things we're doing. We have a partnership with the University of Delaware. It's called Clinical Nurse Scholar. So we met with the 2 teams, with Bay Health and University of Delaware, and we came up with this plan where their students will come to Bay Health and they'll do their clinical rotations. They'll complete them there for the last year of their senior year during school, and then they'll sign on to work on one of our floors. So they get to know us ahead of time. They get to know what they're expecting, and we get to know them. So it starts the partnership while they're still in school. They gain that trust with their nurse manager, with their peers, the people they'll be working with. So it just gives them a comfort level before they get here.
You mentioned data in your explanation, and we were talking a little bit before this that we both kind of love data-driven things. Tell a little bit more about, how you go about looking at that data and the sort of analysis that you might have uncovered something you didn't think that you would see.
I use the data I got from the AMN dashboard to do my DNP project, and I did that on using a workforce dashboard to help nurse managers decrease floating, because if you know anything about nurses, they want to work on their unit when they come to work. And when they get floated out, it just doesn't go well. So we used that data and looked at where were when was it happening the most? Where were we short-staffed and why was that happening? And then we also looked at how many patients do we have, what time of the day, every day of the week, because it fluctuates. But some days you might have more surgery, so your census is a little higher to make sure you're staffed more. The ED gets crowded on Monday evening and Tuesday morning, so that's when we need more staff. So looking at all of those points and staffing according, so we have the right amount of nurses to meet patient demand.